Mafikeng, the capital city of the Northwest Province, one would assume that living here would come with the convenience of easy access to specialist doctors, even at public health facilities. But that does not seem to be the case. Some of the patients at this facility say they have to travel more than 300 kilometers to get medical help. One of them is Penyo Isaac, who has been partially deaf since 2010 after suffering a stroke at the tender age of 13. He says in the past 3 weeks, he has traveled to the Mafikeng Provincial Hospital 10 times without seeing an ear specialist. He has since been referred to a facility 200 kilometers away.
In the Mafikeng, the hospital of Mafikeng, we have a shortage of specialist doctors. And then the shortage because some new ENT is not at Mafikeng Hospital, is far away from Mafikeng Hospital at Klerksdorp Hospital. And then Klerksdorp Hospital is far away from Mafikeng to Klerksdorp. It's 200 kilos.
64-year-old Ellen Manonyane is another patient at the receiving end of the shortage. She constantly travels outside the province to see an orthopedic specialist. She described the journey as tedious.
We struggle
to get specialists. We are tired of being transferred back and forth to Tshepong and Baragwanath Hospital. I now have a serious bone illness and they only gave me pills. If there were specialists, they would have attended to my problems speedily. We really need specialists in Northwest.
Meanwhile, the Northwest Department of Health says getting specialist doctors has proven to be no easy task.
Doctors who are specializing, they are few in the country, that's number one. And if they are few, it means they weigh their options. A rural province like Northwest, they will always say, is it best for me to be in Sandton, working in nice environment, or should I go into a rural area? So most of the time they will choose not to go to the rural area. And that is why when we train, we recruit learners from historical disadvantaged rural areas, where they're thinking that when they come back, they will know that I left a gap back home where I come from. I need to go back and work there.
Some organizations in the health sector say various factors have led to this countrywide crisis.
Last year, 21,000 specialist medical personnel posts are vacant across all 9 provinces. And there's multiple reasons why we see this. But the critical shortage was created by incompetence as well as poor governance from the various provincial departments of health. And there's an unwillingness to address these serious concerns. Provinces must make sure that there is no political interference in the daily workings of these doctors and specialists.
The department has been urged to strengthen its leadership and governance across the country. Sellwane, SABC News, Mafikeng.